today was why we as a funder are engaged in this area of older adults. And you may know that we opened our doors for grant making with the help of Sandy Kravitz in 2001. And we have as our areas children, older adults, arts and culture, healthcare, education, faith-based organizations. That was all the guidance we had. And it was like, holy crow, we can drive a truck through that. What are we going to do? So we all started doing research into these particular areas. And older adults was in my bailiwick. So, you know, I was scrambling, like, how are we going to have a foundation for what we do in grant making in older adults? And I came across Rowan Kahn's Successful Aging. And Mark is nodding, but, you know, the real thing about that is who wants to age unsuccessfully, you know? Doesn't make a lot of sense.
Miserable aging.
So it made real sense because the three areas were prevention of disease and disability, attainment of peak physical and psychological functioning, participation in rewarding and productive activities. So those things really cover the waterfront. How do you keep people as independent as possible? How do you work with disease? And it speaks to what Mark talked about, that you don't retire on Friday and go to a nursing home on Monday. You have a whole period of time in between that is really available and up for definition now. And we're trying to figure out what that means. This, I think, is a wonderful slide. It just gives you the idea. If you look at these two sections of the population, I mean, this is a huge resource that we're not doing a whole lot with. This is the frail population, 85 plus. So we have two really huge sections of population that we need to think about and we can use. I was very lucky in the 3 months after I started at Piper. I went to the the Grantmakers and Aging Conference in Denver, and speaking at that conference was our speaker today. And he talked about the Sun City thing. He talked about the fact that seniors are seniors. We don't use seniors anymore. That they're healthier. They have lots of experience. They have some financial stability. They're educated, and they want to do something. They don't want to work like they worked, you know, in their careers. They don't want to spend 60, 70, 80 hours working for the man or whoever. They want to go play for a while. They want to go and visit their kids. They want to travel. They might want to play golf. And then about 3, 6, 9 months later, they're bored out of their skulls and really are looking for something to do. And Mark's book, Prime Time, if you haven't read, was really the first book. He was a thought leader in this. He really is. I mean, this was the first real kind of laying out that, wait a second here, something new is going on. And it really got Carol Trust engaged in this idea of what could we do to figure out how we could work with this new resource in our community. And we worked with Civic Ventures for 8 years or so, and have had wonderful, wonderful relationships with them. We've worked with the National Council on Aging and a project that a couple of our panelists are involved with, trying to figure it out because there is no template. I mean, that was the thing that we learned is that it really sounds good, but when you want to change an institution or you want to develop a new concept in the community, it's really hard and it takes a long time. From when we started in 2002, I think Mark was like kind of whistling in the wind, and now the Wall Street Journal, the New York Times, a gazillion different books. I mean, it is everywhere now that we have this new wonderful resource. So this is what I wanted to kind of show to you as a grant maker, the kind of things that we've done. We've done about $4 million in this area, and we started out in 2002 really trying to figure out what was the template. And we invested in the Next Chapter projects that you may have heard of in the city of Tempe, Chandler, Scottsdale Mission Community College. And Civic Ventures helped us with that. We were trying to come up with a template. What does it look like? Places and spaces. Is it re-careering? Is it helping people figure out what they want to be when they grow up? And we found that it took a lot of patience and a lot of understanding that some institutions change a lot slower than others. So we kind of went into civic engagement in the community. Experience Matters planning with Civic Ventures. We've worked on Experience Matters that Nora will talk about is this consortium that is bringing in assistance to help nonprofits and individuals figure out this pathway. We're done training of nonprofits to utilize older adults, and that's the project Carolyn talked about with National Council on Aging. We've got a couple folks here from those projects, and they'll talk about that. This is one thing I wanted to kind of mention, though. Macy United Way was one of the agencies in that National Council on Aging project. They're now allocating people and money to Mesa nonprofits because they haven't been able to raise as much money in this economy, but they see this huge group of people as a resource to be able to help their nonprofits. So, I mean, you think about it's not an older adult program, it's a program to help kids agencies. As Mark was saying, kids agencies or healthcare agencies or whatever are using this as a resource in addition to money. We've also invested with trying to train for new careers, and so Gateway Community College has a program in place. We also are doing this intergenerational thing with older adults tutoring kids. So we funded Experience Corps in Mesa and in Tempe in 2006, and it's still going on. And we just funded Your Experience Counts through Rhonda Oliver's organization in conjunction with Experience Matters. That's going to bring the program into low-income Phoenix schools. So the thing that's wonderful about that, here's the older adult who's doing something meaningful. Here's the kid who needs some help, may not have one-on-one help at home. And the child's reading scores are improving, math scores are improving, behaviors are improving. So it's a win-win-win-win-win, and it really covers so many bases. And funders are now getting more engaged in this also. We've been partnering with Arizona Community Foundation for the Experience Matter and the forums. Legacy involved with the forums, St. Luke's involved with the forums, and Grantmakers in Aging and Grantmakers in Arts also nationally are helping to support things here. So this is kind of the way it looks right now for us. It's like putting together, like, remember those big puzzles, like all brown or green or whatever, and you can't figure out what the puzzle picture looks like. And that's really where we are. We're trying, what are the puzzle pieces? What are the things that we can figure out in our community? How can we partner to really improve the situation in our community? Because we all know in our community, especially with the state budget cuts, it's a mess. I mean, we're always talking about he's trying to hold on to his programs, and I think maybe there's ways that we can help to do that. I just put a couple slides in here just as examples of what different nonprofits, what we're finding from different things, and I actually stole some of these, I think, from Carolyn. But these folks come to your organizations with all of these skills. They can do things like legal, accounting, marketing, public relations, grant writing, evaluation, community outreach, things that you may not be able to afford to go and hire, things you may not want to have a whole staff person for, but you could really use a project. So there's these kinds of things, and the leadership potential that's out there is just phenomenal. But the thing that you also have to remember is they don't want to do the same old, same old. They don't want to answer the phones, they don't want to stuff an envelope, they don't want to do filing. They really want to bring their skills in, they want to do leadership kinds of things. They might want to do a bridge job, they might want to do an internship, they might want to do some consulting or self-directed teams. But what we've read, what the research shows is people retire and they feel like they've lost their identity. They have been engaged for their lives and working on projects, working with teams, having accomplishments, and when they retire, that goes away. And so this kind of thing provides an opportunity not only to leave a legacy, but also to engage in specific kinds of periods, short-term periods, so that they can go play golf and visit the grandkids and go play, but they don't have to do that all the time. They can do some other things as well. Sandy's a good example. Sandy, I don't think will ever retire. He's now just graduating as a docent from HURD, the HURD Museum docent program. So Sandy has been finding, I've met with him, I don't know how many times, like, what can I do? How can I help? What can I do? So Sandy has how many years did you say?
About 65.
65 years, and so he's still raring to grow. Sandy's probably a poster child. He's probably the leading edge in this whole kind of thing, and there are lots of Sandys out there. The thing with nonprofits too in this is that the structure of nonprofits isn't really set up to accommodate this type of volunteer or unpaid work opportunity. What you find studies saying is that people oftentimes will say they've had an unsatisfactory volunteer experience because nobody recognizes this is a different group of people. And so you have to really think about how do you organize, how do you structure, how do you do reporting, recruiting, retention, and Nora's project, I think you're going to talk about that a little bit, helps nonprofits to work through that, as did the NCOA project that Carolyn worked with, and Sunny and Michelle. You have to think differently, but you have to recognize these are these wonderful, wonderful resources that you can't probably afford otherwise. The thing that Carolyn was talking about, I think you've got it there at your place, NCOA, they did a return on investment. We had 10 projects that worked with older adults 55 plus, and these folks did a variety of things at organizations. They were either healthcare agencies, developmental disabilities, Benevilla, museums. There were partnerships, a science center. This is the notebook that we did that talks about the methods of significant service. And this fellow in the science center, well, he's become a poster child. People recognize him because he's a retired engineer who's gone in and developed curriculum and projects for the science center on science, technology, engineering, and math. And so the STEM thing, which the kids really need help with, and the Science Center is using these kinds of folks to do that. So opportunities are just, really, really bounded by your imagination. But I think the thing that's interesting that NCOA did is that they identified that the value of the work of these volunteers or unpaid folks in nonprofits is $1.3 billion. Cost the nonprofits $218,000 for a benefit of $1.1. So this is not just like an altruistic kind of thing. This is really something that can benefit organizations. And we're really hoping that we can figure out what's the next step. We are going to work with Nora on her fellows, and we funded the first Encore Fellow, and we'll be looking at doing more of that. But we're looking for different ideas. What's the next thing? What's the next piece of that puzzle? And we really look to you to help us to do that and maybe work with us and partner with us. And I think that to not do that is a real travesty for our community. We have such wonderful resources here. And we can make our community a better place using folks that are already here.